Horse chestnut is commonly used to treat swelling and pain caused by varicose veins and poor circulation in the legs. It is important to be cautious when using herbal or dietary supplements, as some products may contain harmful impurities or additives. It is recommended to consult with a pharmacist to ensure the safety and effectiveness of the brand you use. It's important to note that the FDA has not reviewed horse chestnut for safety or effectiveness, so it's best to consult a doctor or pharmacist for more information. When taking horse chestnut, the daily dosage and optimal timing will vary depending on the individual and their specific condition, so it's important to seek guidance from a healthcare professional. When taking horse chestnut, it's important to follow the directions on the product package. Make sure to check the label to ensure you have the correct product, as horse chestnut seed extract is different from whole horse chestnut seeds. It's crucial not to consume the raw seeds, bark, flowers, or leaves of horse chestnut, as they can be poisonous. Only use standardized horse chestnut seed extract products that have had the toxin removed. It's recommended to use this herbal product for short-term purposes only, and not to exceed 3 months of use. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical assistance promptly. If you experience upset stomach, headache, or dizziness, it's important to talk to your doctor or pharmacist. Horse chestnut may cause your urine to turn red, but this is harmless. It can also cause low blood sugar, especially for people with diabetes. Symptoms of low blood sugar include chills, blurry vision, and weakness, among others. It's a good idea to carry glucose tablets or gel to treat low blood sugar. If you don't have these, you can eat a quick source of sugar or drink fruit juice to quickly raise your blood sugar. Make sure to tell your doctor about any reactions you have to this product. If you experience any serious side effects, such as unusual bleeding, be sure to contact your doctor right away. And if you have a serious allergic reaction, seek medical help immediately. This is not a complete list of potential side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Before taking horse chestnut, it's important to talk to your doctor or pharmacist if you have any allergies, especially to latex. If you have any health issues such as bleeding or clotting problems, kidney or liver problems, diabetes, or stomach/intestinal problems, make sure to consult with a healthcare professional before using this product. Horse chestnut may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or operating machinery until you know how this product affects you. If you have diabetes, alcohol dependence, or liver disease, be cautious when using liquid products that may contain sugar and/or alcohol. If you are pregnant or breastfeeding, it's best to consult with your doctor before using this product. As always, it's important to talk to a healthcare professional before starting any new medication or supplement. When taking horse chestnut, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Horse chestnut may interact with blood thinners such as warfarin and heparin, as well as antiplatelet drugs like clopidogrel and ticlopidine. It may also interact with non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, and herbal products that increase the risk of bleeding, such as danshan, garlic, and ginseng. Additionally, taking aspirin with horse chestnut may also increase the risk of bleeding. If your doctor has advised you to take low-dose aspirin for heart attack or stroke prevention, typically 81 to 162 mg a day, you should continue taking it unless your doctor tells you otherwise. Be sure to consult your doctor for more information. If you believe that someone has overdosed on horse chestnut and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to keep all of your medical appointments and any scheduled lab work. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of horse chestnut, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at the usual time. Don't take 2 doses at once to make up for the missed one. When it comes to using horse chestnut, it's important to follow the storage instructions printed on the package. If you have any questions about how to store it, ask your pharmacist. It's crucial to keep all medications and herbal products out of reach of children and pets. When it comes to disposing of horse chestnut, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.